Welcome to today's webinar, which is called Knowledge Translation as a System, presented by Dr. Tamika Heiden. Tamika is the founder of Knowledge Translation Australia and has been leading the way in helping Australian researchers create a real-world impact through knowledge translation. If you'd like to find out more about what Tamika does, I'd recommend visiting her website, ktaustralia.com. My name is Dee Quinn, and I am the Project Officer from the Cancer Implementation Science Community of Practice, which brings this webinar to you today as part of its education program around implementation science. This program features a series of events including workshops, seminars, and webinars based on our curriculum in implementation science, and is supported by our resources website where you can find useful resources and register for upcoming events online. Before we start the presentation, please note the following housekeeping information. Tamika will present her talk and welcomes your questions. To ask your question, please use the questions box on the GoToWebinar control panel and press Send to All. Tamika will answer your questions along the way. After the webinar, when we close the presentation, a survey will appear on your computer screen. We very much appreciate your time to complete this survey as your feedback informs and supports our future events and education program. If you miss completing the survey online, you'll also receive the link by email. Now I will hand over the reins to our presenter, Dr. Tamika Heiden, to get us underway. Thank you, Tamika.
Morning, Dee. Thank you. Morning, everyone that's online. It'd be great just to double check that everyone can actually hear me. So it might be good if you can please put that in the chat box just to say, yep, can hear you, it's all good, because there's nothing worse than presenting to people who can't hear you and to an empty room. And also just let me know if you can see my screen. Perhaps you can let me know that, Dee.
Yes, I can see the screen from this end.
Perfect, perfect. Letting you know that they can see it. I can't see the chat box for some reason. I can't see the question box. Yeah, I can't see anything coming through in chat box to say that anyone can hear me. I can see that there are 25 people online. Not sure where I'm supposed to see that. Can you see anything, Dee? Because before I get started, I just want to make sure.
Can you see anything in the questions box or the chat box on the right?
No, the chat box isn't showing me anything. The chat box
under questions.
I don't have question, which is interesting. I have audience, sharing, webcam, audio, attendees, and chat. But in chat, all I have is people who can chat to organisers or to, staff. So you're going to have to relay to me the responses because I can't see anything.
So participants, can we use the chat box rather than the questions box? And then we'll see if some of those start coming through.
Yeah.
Because I can see what people have typed in the questions.
Yeah, I just don't have a questions box, which is really unusual. I just have a chat box, but in the chat box, when it says to, you can only type to organisers or you can't send to all. So I'm not quite sure. Got a question. Whoever did that?
That was me. So you can.
Great.
Yep, you're good.
Oops, it's gone again. Okay, I had a questions panel. There we go. Perfect. Okay, so people can hear me. That's awesome. Welcome, everyone. It is really great to have you online and some of you who I have met before. So thank you. Okay, so let's get moving on the webinar today. And I am going to make this reasonably interactive as much as I can for a webinar because, you know, it's Otherwise, just me talking into thin air, which is always a bit weird. I'm not a radio presenter. I'm much more of a conversationalist. So I do like to have involvement from people. And I am using Prezi, so hopefully this comes through okay on your end. I think there is a tiny bit of a delay, but in the first instance, it would be really great if you can just in your chat box, or sorry, in the question box, because I can see that now, if you can just let me know what your role is. I put a few ones here, so you can just put an A, B, C, or if you're putting a D, let me know what it is. So I can see the roles that you guys have. A, yep. Perfect. So researchers predominantly, research support, awesome. PhD, great. Yep. Oh yeah, researcher and consumer rep, perfect. Health professional, nice mix. Postdoc research fellow, yep. Allied health coordinator, yep, perfect. That's great. Good to know. It's always good to know who's listening, so I can make sure that I speak to everyone's different contexts, I guess, and most of you are probably clinical or basic sciences, I'm guessing, in the cancer area. Is that right? Anyone more applied? Clinical, public health. Oh, great. Okay, good mix. Maternal, perinatal, epidemiology. Yep, great. Okay, so first I just want to set a bit of context around what I'm presenting today and really talk through some things that I'm sure that you're all well aware of, but it never hurts to revisit why this is really important and why we're doing this. So why do we need to focus on translation? Well, we all do peer-reviewed journal publications as researchers, but these articles are not getting cited as often as we would hope. And in fact, there is a statistic out there that 55% of papers published between 1981 and 1985 in journals indexed by the Institute for Scientific Information received no citations at all in the 5 years after they were published. And there's also other research from the Smithsonian magazine that found that half of academic studies are never read by more than 3 people. So thank you, mum, dad, and a reviewer. 3 people, that's pretty sad. And it's a lot of work to not have our work go any further. And that's why when we think about translation, we have to think about all those other things that we can do to get the work out there. But also in doing that, hopefully people do go back and read those peer-reviewed journal articles that we're spending so much time on. So it's a win-win situation. The second thing we need to think about is how we can make it easier to use new knowledge in practice, because at the moment clinicians would need to read 20 journal articles a day to stay current. And I can imagine those of you who work in the clinic are thinking there's no way I would have time to read 20 articles a day and do the work that I do, because it's just ridiculous. So we have to make it easier. We need to work out ways that we can share this information and get this implemented in a much quicker way. We also have seen that there are results of studies, USA and Netherlands, that suggest that 30 to 40% of patients are not receiving care according to present scientific evidence. It's a little bit scary that some of the care that's provided is potentially harmful or out of date or no longer relevant, and that there are better things that we could be doing. Thirdly, we want to reduce the waste. So there was some research done on research wastage, and it's been estimated that 85% of research is wasted in the life sciences. This was research done in 2010, because they found that this was because research was often asking the wrong questions, wasn't well designed, or was poorly reported or put into other ways of sharing that information. And also we want to reduce the time to uptake. So there are also the publication around, you've probably seen this one, the 17-year gap, which we hear all the time. But even after 17 years, only 14% of health and medical research is being put into practice or being used or being implemented in some way. So 17 years is an awfully long time to wait for information. And obviously this differs across different types of science, and I understand that completely, but ultimately if we can, then we can move things along much quicker and make those big changes that we all got into research to make. So I want to do a little activity now, and normally I do this live, so it's going to be a bit weird, but I'm trusting that you are feeling keen to type in the question box and to do this interactive activity for me. So the first thing we're going to do is I'm going to give you an exercise in knowledge translation, which I'm now going to call KT, just so I don't get tongue-tied, and perspective. Now, there are some rules to this activity. You can ignore the can't discuss with each other because you can't discuss with each other, you're online. But what I want you to do is I'm going to show you a map, and I want you to think about, with this map, how you would plan your route home after this webinar, say. That's if you're not sitting at home. So pretend you're not at home. Say you're in a workshop and I'm telling you that you want to use this map I'm going to give you, and you're going to use this map to get home. Now, while you're working on this, I want you to think about what the consequences would be if you can't use this map and if you can't get home. And you can't ask me questions, but what I want you to do is we're just going to move through this quickly. And in the questions box, I want you to write down how this, what you're experiencing, how you're feeling, what would have made you more successful in accomplishing the task of getting home with this map. I will show you now the map, and hopefully that will come up for you now or in a couple of seconds. And I want you to start thinking about how you're going to use this to get home, and what would make this successful for you to use. It's all quiet on the question box. Yep, knowing where you're starting from. Yep. Yeah, where are you and where's home? Absolutely. Anything else? Yeah, find someone to help you, having a map in English, direction on how to use it. There's a lot of stuff about language translation. Yeah, which color paths, a bigger screen to see the map. Yeah, understanding the map, okay. I like the where am I and where is home. Yep, where is home? How much do I have? How much does it cost? Yeah, good idea, good question. What's the starting point? Absolutely. What's the difference between the fat and thin? Oh, I love that you guys are thinking about some really key things. What we've found, oops, sorry, let me get back there. What we've found when we've done this task is that often people have said that they need to know, where you are, where you're going. Obviously, understanding the person I'm giving this to and their language preferences. So giving this to you in Japanese, and by the way, it's the Tokyo subway map. Giving this to you in Japanese is not helpful, right? So also telling you where you are in relation to the map, so the context, knowing where you are, how much you can pay to get home. That's someone did put in around the cost. And really importantly, not taking a one-size-fits-all approach, because for each one of you, perhaps you needed a different map. Perhaps one map for each one of you was not relevant. The reason we've done, often as researchers, we are giving our stakeholders or our knowledge users, we are giving them a Tokyo subway map. We're giving them something they don't understand. It doesn't fit into their world. They don't know how to interpret or how to use it. We're making it difficult for them to use. We are taking the one-size-fits-all approach where we just publish a journal article and give it to people, or we publish a clinical guideline or a clinical practice guideline and give that to the same audience. But in fact, what we need to think about is what's relevant for the people that we are giving the information to. And that's going on their context, their experience, the language they speak, where they're going, all of those types of things. So that's why I use that activity, and I hope that made sense to you. It's a difficult one. I've never used it in a webinar before, but I thought it would be fun to make it a little interactive. So what I want to get into now is that terminology and some definitions. So let's talk about knowledge translation, KT. What is it? Well, the World Health Organization definition is the synthesis, exchange, and application of knowledge by relevant stakeholders to accelerate the benefits of global and local innovation in strengthening health systems and improving people's health. What's key to note about the definition is the terminology around synthesis, exchange, application of knowledge, relevant stakeholders, and then, you know, that accelerating and improving things. So knowledge translation is all of those things. It's exchange, it's application, it's strengthening things, it's improving things, it's how do we move things. Now, this often gets confused with translational research, and translational research as a definition is to research translation. It also sometimes gets used to refer to the T1 sort of translation, and that bench to bedside or bench to first time in man kind of idea. But ultimately, translational research is when we do research on translation methods. So let's go back to KT more broadly. So knowledge translation is the process of moving knowledge into action. So it's where research becomes something much more tangible. This will differ depending on the work that you're doing and the area that you work in, of course, but it's that next step. It is a complex and confusing topic. It has a multitude of terms, so if you're confused or have been confused, don't be surprised. There are over 92 terms used for translation. And within the health region, there are 52. So that's health and medical area. There are 52 terms that get used. Do they all mean the same thing? No, but they do get used. Seen even here that we interchangeably use research translation and translational research. It sometimes gets confused with dissemination, communication, or commercialization, and it's all of these things. All of these things are part of the system, and you're going to see that when I show you, walk you through. It is importantly a social, non-linear process, and it's built on relationships. So whether we can get something to move from one area to the next, to be used or to be understood, depends on relationships. There is research out there that has shown that the likelihood of uptake of research is based more on the strength of the relationship than on the strength of the evidence. Now that's a little scary because it means that weak evidence might get used based on a strength of a relationship, but it also shows and highlights the importance of the relationship if you want to influence use, uptake, change, any of those things that we need for translation. By the way, I really like that someone put in there that they didn't want to go home from the map. Now, I have a question here, how many terms do you think exist? And I've already told you that. Here are some key ones. Are there any other key terms that you have heard aside from these that get used for knowledge translation? Just put that in the chat box if you can think of any. And while you're doing that, I'm just going to briefly mention what some of these terms are. So knowledge mobilization is used in Canada in the social sciences sector. Knowledge translation also comes from Canada, from the health and medicine sector. Research translation is an Australian term used by our NH and MRC. Knowledge exchange and transfer, or transfer and exchange, is often used in the UK, as is research utilisation. Engaged scholarship came about in the education sector, and that's used widely in Canada. But typically, we have a multitude of terms. Bench to bedside, yep. KTA, knowledge to action. So that KTA, knowledge to action, really comes from a model of translation that was published. So yep, absolutely. So really, we can get really tied up on terms and terminology. And what I like to say is, I don't care what you call it, as long as we're all on the same page about making a difference and doing more with our work. So, but it's really good to understand that there are a lot of terms, so that if you are doing a literature search or you're looking for some research around translation you know that there are many, many things that you're going to need to search for if you're looking for information. It's not always going to be knowledge translation or research translation, particularly research translation. You're not going to find much if you search under research translation, particularly internationally. So I want to run through some definitions. And the first definition is that of a knowledge user. So we talk about stakeholders, we talk about next users, beneficiaries, end users. So a knowledge user is an individual who is able to use the knowledge that's generated by research in order to make decisions or to use programs and practices. The level of engagement in the research process will vary depending obviously on the nature of the research, but also depending on their needs. And it's someone who may be a practitioner, they might be a policymaker, an educator, a decision maker, a healthcare administrator. So it could be any multitude of different roles or people. Implementation science, a different field, is a question that's come into the text box. Thank you, Natasha. I'm going to get to it, but implementation science sits on the knowledge translation pathway. So hopefully you'll understand that in a moment, and it'll be a bit clearer. So this is the definition that Canadian Institutes of Research have put through as a knowledge user. So when we think about who's going to use my knowledge, it might even be another researcher. So if the work you're doing is very much bench-based, it would be another researcher. So that knowledge user has a context of their own, and that context happens to be an academic context, which is fine. But if the knowledge user happens to be a clinician or a nurse or a health service provider, then it's very different to think about who that might be. Then we have two different types of knowledge translation. We have end of grant knowledge translation. So this is about disseminating or applying knowledge at the end of a research project once we've found whatever it is that we've been looking for. And we have the integrated knowledge translation, which is the way of doing research that involves those decision makers or knowledge users as part of the research team and in all stages of the research process. I'm a big fan of integrated knowledge translation, but I also am quite aware that in the cancer field, this is not always going to be appropriate for every type of research. But having people who are ultimately going to be knowledge users be informed at the beginning or have them as part of a conversation around the importance and relevance of the work that you're doing is really valuable. Now, you might have heard of these strategies of KT, push, pull, and co-creation. So just to walk through these, we talk firstly about push. Now, push is where you disseminate that information. So thinking about, if we think about that, typically it would be a journal publication, a conference presentation, it might be a plain language summary, or it might be through social media. It's where you're pushing that information out to those audiences that you believe need to receive it. Now, the question is in research now, absolutely. So engaging consumers is great. And if you're talking about consumers as patients, absolutely. But there's also that middle person, which might be the clinician or the person providing the service or changing the practice or who runs the programs. So that would be another person to think about engaging as well. The second part of this is user pull. And this is when users would come to you and ask for information to use in their decision making. So we see this sometimes with policymakers who need some information to make decisions. We might see it with clinicians who want to try and change practice or do new things in the clinic. And it could even just be from media when they need information. So they would come and pull that information from you. And then we have exchange and co-creation. So this is when there are interactions between knowledge users and researchers that result in mutual learning. I'm a big fan of co-creation, and if we think about integrated translation, it's very much that exchange and co-creation. So this is where there are partnerships with end users and stakeholders, much more collaboration, a lot of sharing and learning of knowledge. So when we think about knowledge, it's not just research knowledge. Really importantly, there is knowledge of lived experience from those consumers. There is knowledge of clinical practice. There is knowledge of, might even be the politics of an organisation and how things work within that organisation. So that context piece, that knowing whether or not the Tokyo map is suitable. So thinking about those different types of knowledge relationships helps you to navigate that. So because translation is quite technical, it's quite confusing, there's a lot of definitions and a lot of terminology, Sudsaward in 2007 came up with a list of characteristics to help people to think about knowledge translation. So it includes all of those steps between creating new knowledge and applying it. It needs multi-directional communications, it's interactive, it requires ongoing collaborations among relevant parties. So those relevant parties might be other researchers, might be stakeholders, might be consumers. So thinking about the relevancy piece. It includes multiple activities, so it's not that one size fits all. Lots of different things depending on who you're sharing your knowledge with or what it is that you might be implementing if you're doing implementation science. It involves a diverse knowledge user groups. It's user and context specific, so thinking again, context. Context is key, but importantly, knowledge translation is impact oriented. Knowledge translation is our pathway to how we create impact. Now, I just want to delve in a little bit because we talk a lot about innovation. And knowledge translation, you know, I said that people have said it's a lot like commercialization, but KT delivers both commercial and social innovation. And if we think about innovation as a product, intervention, process, or an idea, then we can look at this model from Phipps that has shown how those three elements of push, pull, and co-exchange all come together to create innovation. So if we think about industry pulling information, universities pushing information, and the how of innovation is that KT piece of bringing them together and having the collaboration between industry and university that creates innovation, which is the what. So what is impact? We've briefly touched on impact, and I don't want to delve into this too much because it is about translation rather than impact, but because translation leads to impact and because impact is such a hot topic at the moment, it's always good to cover this off. So I'm not talking about citations or bibliometrics. I'm talking about external impact. What are the social, environmental, and other environmental, health, what are those types of impacts that are happening beyond the contribution to academia? And this definition here that you can see on your screen is now research impact in a text. We are doing that is economy, society, culture, national security, public policy, health, the environment, or other quality of life. Now, someone asked before about implementation science, and I'm going to walk you through a model now to help outline and explain what knowledge translation really is, like to give you a bit of a pathway. And like I said before, there's tons of models, there's tons of frameworks. This is very much an integrated model that I'm going to walk you through, and it's a model that has been adapted from the Canadian Institutes of Health Research. It's been adapted based on the work that I've been doing here in Australia and a lot of the researchers I've worked with, and an understanding of how it fits into your world as a researcher. So let's talk about the life cycle. So I like to think of knowledge translation as a system of processes. And if we look at all these processes, this is knowledge translation. Knowledge translation is not just that thing that happens at the end of your research project. Knowledge translation, and particularly if we're thinking integrated, involves every single process from beginning to end. You'll remember those characteristics I went through from Sudsaward. So we start with having researchers and knowledge users who develop their vision for change, who come up with an idea of what it is they want to work on, what's important, what's relevant, what they need. And if we look at this top row, this is typical research process. We create questions and methods, we do research, the research process, and then we have something, we find something, or we don't find something, or we find something other than what we thought we might find. But we have some outputs from that research, some new knowledge. If we delve into creating questions and methods, typically we use literature and previous research to develop up our questions and methods. And that I'm not saying is wrong. I'm saying when we do translation, we overlay that with a bunch of other processes when we do integrated knowledge translation. And what this looks like is right here at this stage of creating questions and methods, we start to consult with those stakeholders of market research, determine up our vision for our work, work out what's needed and what's relevant to the people we are ultimately trying to serve, whether that be the consumer and also those other stakeholders. We also form collaborative partnerships. We get our partners or our stakeholders to get involved in the project, to get some buy-in. And we plan for translation. We write our KT plan right at the beginning so we know who's involved, why they're involved, the role they're going to play, and what our outputs are going to be or what we hope they will be. It doesn't mean they will be, but we need to plan for the best case scenario. Then we have the research process. And during the process of research, usually, we can't say to our stakeholders, hey, we'll see you in 4 years when we've done our research and we'll come back. We have to monitor and manage those relationships. So we need to continue to engage with those people. We want to think about whether or not they have an ongoing role, how we're going to report to them, how we're going to involve them, how we're going to keep that relationship ticking along and make sure that we can have some maybe milestones along the way that keep them happy, because 4 years is a long time to wait for outcomes. But if we can keep the relationship ticking along, if we can give them little bite-sized pieces of yes, we're on track or no, we're not on track along the way, that is really valuable. And thinking through those roles and responsibilities. The stakeholders that you work with will bring incredible expertise to your work, and that'll be incredibly valuable if you want to A, have buy-in at the end of your project, but B, if you're trying to develop up something really meaningful. And it also helps you to understand better someone else's world and their context and to walk in their shoes. So it's incredibly valuable for learning, for your career development, and for all those things. But often it's scary because relationship management is not something that researchers typically got into research to do. And then we have our knowledge from research, and these knowledge are our outputs. So what is it that we have? Typically, we see that this is done through dissemination. And in this system, we have two ways of sharing knowledge. One is disseminating and the other is using, and I'm going to walk through this. So firstly, the dissemination of knowledge, and this is typical things like publications and conference presentations. We've all done them. We know we have to do them. They're highly valuable, highly regarded, and absolutely vital and important. But there are other things we can do to layer on how we might disseminate our knowledge. And remember I said before, multiple sharing that. So there might be social and other types of media that you do. You might use a plain language summary, or you might just be providing feedback to your stakeholders. But no matter what you do, it's about understanding the stakeholder you're working with, understanding their world and how they want to receive that information. An example I give here is that if you are working with teenagers, the way that you would share your information would be very different than if you were working with 70-year-olds, because they want their information in a different format, they access their information in a different place, and it's an easy example to give, I guess, with an age difference. But thinking about the demographics and how it is they like to absorb their information is important. Now I'm just going to pause for a second. There's a couple of questions. What are the relevant barriers to translating knowledge, and how can researchers minimize them? So yeah, what are the barriers? So barriers can be anything from politics of an organization. It can be that what you're doing is not timely, not important. The way to minimize them is really about having those relationships, understanding what it is that the next user, whoever that might be, the clinician, the health service, what is it they need, what's important to them, and what is it they need and what format so they can use it. This is how you minimize those barriers, understanding their world, getting them on side so essentially they feel like they're part of the process. And then there's another question, copy of the slides. I can send a PDF of the slides. This is being recorded so you can watch it again later, but I can send a PDF, no problem. What's the best way to engage policymakers, or what form of information is likely to be pulled from this group? The best way to engage policymakers. That's an interesting one. And it depends on the type of policymakers you're talking about, but ultimately we have to build relationships with anyone that we want to engage. And that can be all sorts of techniques to being really savvy. I'm going to come back to that question at the end once I get through this model. about the ways that we share and disseminate that knowledge, and again, multiple and layering. And then we want to think about, if we are to use knowledge instead of just disseminating, what are the implications of the knowledge? Now, this is where it comes back to having that buy-in from the stakeholders that you've involved at the beginning. So if you have those people involved and as part of the project or informed, and you've built those relationships, when it comes down to thinking about what the implications are and understanding the context and tailor-making those solutions to share, then this is where that is really valuable, that buy-in. Implementation. Someone asked about implementation science. So this is implementation. So one of the things that happens is, once we have knowledge or we have products or services, we implement it. Now, this is applying that knowledge to tackle those health challenges. And it could be through commercialization, it could be through new guidelines, it could be through clinical practice changes or service provision, or it might be through policy. Now, I threw in a couple more definitions because implementation science sits right here. And implementation science, and also just another thing to note, is scalability and sustainability. So thinking about, when you are applying knowledge, is it scalable to other sectors, regions, organizations, and is it sustainable? So how sustainable is the implementation you've done? And trying to consider that in particular. Now, implementation is using strategies to adopt and integrate evidence-based health interventions and change practice patterns. Implementation science is the study of those methods to promote the integration of research findings and evidence into healthcare. So implementation science, again, is like translational research. It's the research into implementation. And from implementation science, we know a few really valuable things. We know that if we want to implement something, we need to have peer support. We also know that we need ongoing coaching. And one of the other things that we know, really interestingly, there's a whole raft of these things. You can go and read the CIFA, which will help you to understand all the different areas of implementation science, and I'm not going to delve into it anymore here. But one of the other interesting things that we know is, one way to get people to implement something is peer pressure. It's really underutilized, but it's really, really good. It works. So thinking about supporting people, ongoing coaching, there's also things to consider around implementation failure. There's a whole raft of things to think about when it comes to implementation, but for the purpose of today, I'm just trying to show you that it sits within the knowledge translation pathway. And finally, on this pathway and in this system, we get to impact. Now, this is not a linear model. It's just, it's hard to represent a model that's not linear. So we get to impact. So if we implement something, or if we share something, so within knowledge translation, whenever we disseminate or we implement, we need to think about what is the impact of that effort. So this will influence future research. Key to this is having an evaluation built in. So what does success look like, and how will you know you achieved it? Impact definitely shows that people knew what to do with the knowledge you shared. I love this quote from Dr. Melanie Barwick. So if you're sharing something in a way that's relevant to them, so if you think back to the Tokyo subway map, people can use it because it's meaningful to them, it's in a language they understand, it fits their context. So that's when you will have impact. Also importantly, is impact is measured at the level of the user. So when someone comes to you and says, what is your impact? What did you want it to be? And who are you trying to impact? And then you need to go and talk to them. So that is the system of translation. So as you can see, it involves everything right from the beginning. It involves having good relationships, getting buy-in, thinking about dissemination, thinking about use. Not everything is going to be a product or something you can use or implement. Sometimes it will just be dissemination. So even if it's just dissemination, I plead with you to think about the impact of your dissemination, to create an opportunity you don't wanted to do. So if you think about mainstream media, we don't know who's viewing it, who's reading it, or whether it changed anything. Yes, it's a great means of improving exposure of an organization. It's definitely a strategic move. But if you're trying to share information for the purpose of getting people to understand something, to care about something, you need a way to be able to capture whether or not you've done that. So really do think about, how are you going to capture that? If you're running a public seminar or an information session, one of the things that you can do is build use of tools like Zeetings is one I love, where you can do online live feedback from the audience during that presentation. So it's really valuable to be able to use something like that. So you can have Q&A, you can work out who the demographic, what the demographics of the people in the audience are, or you can do follow-up survey, but follow-up survey responses are pretty difficult to get. Now I just have another question. Do you have suggestions for existing impact frameworks? We've used the Australian Health Service Research Impact Framework in the past, but struggled with the time frame needed for many of the items. I'm not familiar with the Health Service Research Impact Framework, actually. There are a ton of impact frameworks out there. The UK obviously are leading in this area because they've been doing a huge amount of work in impact. Yeah, off the top of my head, I can't think of one right now. I would definitely look at some of the fast track impact stuff on their website. I would look to the UK and to HEFKey because they're publishing a lot of work in the impact space. Timelines are always going to be tricky. It can take 20 years to create impact. So what you want to do is think about what your short-term outcomes are and what the long-term outcomes are likely to be based on the short-term impacts or short-term outcomes, just so that you can try to extrapolate that impact. Ben, so what are some good ways of demonstrating research impact? What metrics do you think are most persuasive? Well, the metrics that are most persuasive will depend on who's capturing them. So if you are writing a report for the ARC, then the metrics are whatever the ARC want. We know this from funding typically. Good ways of demonstrating research impact. So think about the type of impact that you want to have. So for example, I'll just give you a couple of really brief examples because this is not really about impact. But if you're looking at health and well-being, something that might evidence impact would be perhaps reports on changes in quality of life years, statistics that reflect changes to the number of admissions or presentations at hospital facilities over time. It might be reduced wait times. It might be from patient surveys. There could be testimonials from clinical staff. There could be improvements to service based on a new clinical practice that's been implemented. So those types of things would be impact, examples of evidence of impact. So then, thank you, great. Just on, I have a few more questions, but I've tried to answer them as we've gone through as well. I wanted to give you a case study example, and it's not a cancer example. It's an example that I really like because it's easy to describe on a webinar. So it's to do with the Peterborough Youth Homelessness Shelter in Ontario, Canada. They had a partnership, so they wanted to co-produce research with York University. The goal of the research was to reduce recidivism and also because they needed to save money because they were getting less and less money from the government to fund their services. So the project looked at introducing a mentoring program in the shelter in order to help people while they're there, and hopefully they wouldn't need to return. The process of this was that they involved, so the researcher came on board to do the project and they needed people to run the mentoring program. What was happening was that there were already social work students from the university who happened to be working in the shelter, doing things like cooking, making beds, cleaning, those types of things. But what they did was they put these social work students to work doing the mentoring program. And this actually created jobs. And so the outcomes of the project, when they had done this mentoring project and they finished the research, was that they reduced the length of stay. So they didn't reduce recidivism, but they reduced the length of the stay, which freed up spots for other people that were in need. It created jobs for those social work students, and to this day, social work students at the York University are preferential to getting jobs within this organisation and now within other organisations because the shelter became a training organisation, which means it was eligible for alternative funds. When I say it became a training organisation, they started to train men's shelters and other organisations of similar need within the area of Ontario in offering up this mentoring program. And because they became a training organisation, eligible not only for the funds they were receiving as a shelter, but for funds as a training organizer. So this helped them to stay afloat. And on top of that, the researcher who did this work won a university medal, and I think they're writing a book, and there's a whole raft of things that came out of this. So this is just an example of how solving a problem in partnership with someone has helped to both improve the service, create jobs, and help them to get money from alternative services. So 3 really great outcomes simply from one project working in partnership with an organisation, which is a pretty nice example, and it's a nice, neat example. So the key points to take away from today: get involved in any priority setting for research projects. Think about the relevance and need. Co-create projects, set the goals, discuss the outputs, think about the context piece, and think about relationship building. Not easy, but there's a whole raft of strategies you can use. Discuss the role stakeholders can play in the process. So when, what, and how are those stakeholders going to be involved? What do they bring to the party? Maybe they have equipment, facilities, maybe they just have some capacity to help you in some way. So think about really getting value from them as well. But also remember that you're building a relationship, so you're not telling them what to do, you're asking them to be a part of your process and trying to get them on board with what you're doing. So you both need to be malleable and think about what it is that's important to both parties. And consider both clinical and research needs. So understand each other's worlds, really speak to one another. Certainly don't go into your stakeholders with the idea that you know what you're doing and you know best. Listen to them, listen to what they want, and remember they probably speak a completely different language than what you do. So you're going to need to take some time and interpret what you both mean, because you may be speaking the same thing, just using different words. So let's look at what we have in the questions now. So for more help and information, if you want to reach out to me, I'm on Twitter at KT Australia. That's my email, theheiden@ktaustralia.com. And if that's too hard to remember, you can always email info@ktaustralia.com. So let's have a look here at a couple of questions. What strategy can you adopt to engage stakeholders with dynamic priorities? Can you, Andrew, tell me what you mean a little more by dynamic priorities? Ben, how would you go about initiating a discussion relationship with an organisation you've not worked with before? Yeah, great. So developing up relationships is a really difficult thing, but also a really big part of what I'm helping people with. So I would say you need to firstly find someone in the organisation to reach out to. There are a couple of strategies I use for this. So it might be LinkedIn, which is a great way to work out who someone is, the role they play in an organisation if they're on LinkedIn. Otherwise, you can simply try and find someone's email and cold email them or cold call them. Now, my advice here, regardless of whether it's LinkedIn, cold email, cold call, what's the value? So why are you contacting them? Make it a valuable reason. I always start with, I'd really like to sit down with you. I'd like to learn more about what it is that you're doing in your organisation. This is the type of, this is the type of work I do, but I ultimately want to meet with you, talk to you, because I want to learn more about what you do. You don't try to start that relationship by saying, I want to talk to you about working with me, because that's just a bit too forward if you've never met someone before. So to initiate a discussion, a relationship, it's always about just spending time to get to know one another, to learn more about each other's worlds. Typically, if you take a nice, genuine approach where you just want to sit down, take them for coffee, be mindful of people's time, then ultimately I've had about a 98% success rate. Pretty much no one ever really says no, and that includes all the way up to chief scientists. So it's really about the approach. It's about saying that you want to learn from them, because to be honest, and this is the secret, everyone wants to think that they're adding value to someone else. So if you tell people that you want to learn from them, they get chuffed and they think, oh, someone wants to learn from me. So that is always a great way to approach people. Be honest, and yeah, just be more social, because that's what translation is about ultimately. So don't be scared. That's the biggest thing that holds us back, is fear of connecting with people. Take the leap, be brave, and take that chance to build a relationship other thing I always say to people, and it doesn't matter, if you email someone, if you call someone, if you try to connect with them on LinkedIn, the worst thing that can happen is they say no thank you. It's okay. It doesn't matter. It's a little dent in your ego for 2 seconds. But ultimately, if you don't ask, you don't get. So reach out, be brave. The other thing you can do before you reach out, if you want to, is to find out whether or not anyone already in your circle has a relationship with someone in that organization, or a relationship particularly with the person that you're looking to build a relationship with. Again, this is where LinkedIn becomes really helpful, because you can see if any of your existing connections are connected to that person or to someone in that organization. So I would definitely use those strategies. Elizabeth, for an ongoing project, challenges is persuading them around the RCT design. Or a large sample size. Any suggestions how to communicate or negotiate this? Yeah. You know, it's randomized control trials are always tricky in this way. Absolutely. I think, and without knowing any more context, this might not be good advice, but one thing that you could do is to definitely say that the people who aren't being randomized to whatever the implementation is, or the intervention is, that you will give that to them later if that's suitable, so that you know, people aren't actually missing out over time. It's just that in the interim they are, but that depends entirely time than that. Other than that, I would just try to really show proof or evidence around the value in this circumstance of using an RCT. Go back to what their goals are. So if you can tie anything you're doing back to someone's goals and what they value. So they, you know, they value getting results. They value success. They value whatever it is you're looking to do, obviously, because they've come on board with you. You need to show them without a doubt that using this method is how they will achieve that goal. And you need to speak to their values, or what they value and what they hold true. So Andrew, I think this is about the dynamic priorities. That is, their priorities constantly changing with time and cost. Yeah, of course. So we're talking about pretty much any politician as well. But you've put here stakeholders is cancer, pharmaceutical industries. Yeah, so dynamic priorities, absolutely. It is really tricky. And working in that type of industry is never going to be easy. I would still engage with them, even though they are having constant changes and their priorities are always going to be different. I would definitely think about having a good relationship with them, because if their priorities are changing that often, you never know when their priorities might change back. I think the key for you, Andrew, will be to acknowledge that this is, you know, an area where things change quickly, and that you might start doing work with them on something that is no longer of importance to them at the end. And there's not much you can do to overcome that, but to try and still hold true to whatever it was that you were, whatever the vision was when you started the project, and try to keep tying them back to the vision of what it was they were achieving as well. It's not always easy with pharmaceutical industries, because obviously they have their own priorities, but if there is a key vision that you all tie into for the project and for where they ultimately want to end up, and if you can align it with their organizational vision and where they want to go as an industry or as a, you know, as an organization, then I would definitely do that, tie it back to that, and try to show that what you're doing works towards meeting that vision. And that's a really great one for anyone working with any industry partner. If you can tie what you're doing into how they achieve their vision, they really can't say no to you. Okay, Mark. So researchers may have to change their preferred method of research. RCT may be gold standard, but might not be appropriate to the partnership. Yeah, absolutely, Mark. I mean, I think this is the thing. to think about working with partners. If it's coming down to that you can't have that partnership and work well together because of the method, then you are going to need to try to be a little bit more flexible within reason. You still want it to be strong science, but really try to be open to exploring the options that you have available to you. You've got to remember that this is a different way of doing research. We're not sitting in a room making decisions on our own in this type of world, which, you know, it still happens. There is still discovery research, but ultimately when we want partners to be involved and we want someone to buy into whatever it is that we're doing, we have to have some pretty open discussions and be willing to be flexible within reason, as long as we're still doing high quality science. Thanks, Mark. That was a good comment. Any other questions or comments? I'm happy to hang around here right until 9 or just after. Hopefully you guys have gotten a little bit more of an understanding of translation as a system and how all the other pieces fit into it. More than happy to take any other questions by email if you think of anything later. Yeah. You're welcome. Thank you. No problem, Catherine. Great. Thanks, Douglas. Great, Tracy. No problem. Yeah, exactly, Mark. So you got to remember that sometimes we don't find what we're looking for in research, but we find something else, or we create other incidental impacts which can be more valuable or just as valuable. So yeah, great. Thanks, Mark. Yeah, great, Jeanette. Thank you. Thanks, Catherine. Thanks, Hannah. Thanks, Rue. Thanks, Matt. Thanks, Sharon. Thanks, Maria. Have a great day, guys. Thanks, Andrew. Thanks, Elizabeth.
Thanks so much, Tamika. That was really great. I'm going to end the webinar now. Just a reminder to everyone to please complete that survey. And obviously you've got contact details for Tamika if you have any questions.
Dee, can you send me, I think you end up with a printout of the questions. Can you send it to me when this is over?
Yeah, sure.
Great. And I'll send through a PDF of the presentation for you as well.
Perfect. Thank you so much. Thanks, Tamika.
No problem. Everyone have a great day.